They are all surrounded by these bony bridges.
Ankylosing spondylitis is a chronic inflammatory disease that results in arthritis of the spine. The inflammation of the vertebrae can eventually cause them to fuse together, creating a loss of spinal mobility and function.
Ankylosing spondylitis primarily affects the spine, including the neck, and if it involves other joints, mostly it is the root joints, the hip.
The earlier patients are examined by a rheumatologist, the better their chances will be both in managing their disease and protecting their spine.
People need to understand that it's a chronic disease at this point. It will be with them for the rest of their lives. We have treatments, but as of today, those treatments are lifelong.
Knees straight, don't lift the heels up.
Dr. Muhammad Khan is a 62-year-old rheumatologist at Case Western Reserve University in Cleveland, Ohio. Dr. Khan has been practicing medicine for 40 years. He has had ankylosing spondylitis for 50 years.
And with fusion of the spine, the inflammation goes away. The person may not have pain, but they have a lack of mobility. So after half a century of the disease, I have no pain. I have no back pain or stiffness. But my spine is permanently stiff because it is all fused. So I have total fusion of my neck and rest of the spine. And this is what should be prevented.
Okay, so lean forward. And
In order to diagnose this disease, a rheumatologist examines the patient's spine, as well as test their range of motion. Doctors will also review the patient's MRI to confirm their findings. The physical exam is still the most important part of the diagnosis of ankylosing spondylitis. By the time most patients seek a rheumatologist, the impact from the disease is already present.
So in the last 5 years, there is very convincing evidence that for those patients, TNF blockers are very, very effective. And one can find out whether they are going to respond to TNF blockers within 8 to 12 weeks. Not as damaged.
Having treated AS throughout his medical career as well as having to live with this disease since childhood, Dr. Khan didn't allow it to stop him from having a complete and satisfying life. He's learned to adapt at work, at home, and in his art. This self-portrait was created to express his personal experience living with AS.
Most of the patients can have a very fulfilling life. They can get married, they can have as many children as they want. Just because they had the disease, they shouldn't worry that their children are going to get the disease. It would be nice to have a drug that is cheap and is effective in the form of a tablet. So my prediction is that with the work going on, there will be cheaper and more effective and safer drugs, at least I hope.